Good morning.
Good morning. Oh, ma'am, please come in and take a seat.
Thank you, Miss.
I'm Dewi as a midwife in this hospital. May I know your name and how old are you, ma'am?
My name is Tungga. I am 22 years old.
Where do you live, ma'am?
I live at Harapan Indah Street, number 22B, Bekasi.
Okay, could I help you, Miss Tungga?
I want to check my pregnancy.
Have you been to an obstetrician before?
Yes, I went there 3 weeks ago with my husband and I got an ultrasound. However, the gestational sac is still too small.
Okay, ma'am. Do you remember when your last menstruation period was?
If I'm not mistaken, it was on January 14, 2020.
Is it your first pregnancy, ma'am?
Actually, yes. We didn't plan this and I'm worried.
It's okay. Don't worry too much, ma'am. So your current gestational age should be 8 weeks if you are sure about your last menstrual period. Now, I will check your blood pressure and pulse. Could you lift up your sleeve, please?
Yeah, sure.
Your blood pressure is 110 over 80 and your pulse is 85 beats per minute. That's normal. Next, I'm going to check your temperature. So I want you to put this thermometer in your armpit and wait a few minutes.
Okay.
Your temperature is 36.7 Celsius. That's normal. Have you ever measured your height before?
Yes, it is 162 centimeter.
Okay, ma'am. Could you stand here? I would to measure your weight.
Of course.
Your weight is 65 kilogram, ma'am. Please have a seat.
Thank you.
Well, what are you feeling, ma'am?
I feel bad. I throw up every morning and I can't eat well because I always feel nauseous.
It's called morning sickness, ma'am. This is common during the first trimester of pregnancy. That's normal. And usually in the second trimester, the symptom will end.
Could you tell me what should I do to reduce my nausea and vomiting?
Even if you feel nauseous, you still have to eat so your baby can get no nutrition. You have to eat whenever you feel hungry. It doesn't matter if you eat in small amount, but the frequency is often. I will give you a vitamin called vitamin B6, which can help reduce your nausea.
Oh, thank you, Miss Dewi. By the way, can I eat McDonald's?
You should eat healthy food because junk food doesn't contain enough nutrition needed for baby growth and development.
Okay. Thanks for the information.
With my pleasure, is there anything else you want to ask, ma'am?
Uh, sometimes I f- um sometimes I have a headache. Can I take paracetamol?
Is your headache really bad?
Sometimes I feel worse when I have a headache and nauseous at the same time.
Okay, so whatever pregnant women consume will have an impact on their growth and development of the fetus, including drugs. That's why during pregnancy, the mother is prohibited from taking medication without the knowledge and or advice of a doctor. The reason is there are several types of drugs that have impact on the fetus. So their consumption is not low or the dose is reduced when pregnant. Actually, there's nothing wrong with taking paracetamol when you're pregnant. However, the dose must be in accordance with the doctor recommendation so that it doesn't have a negative impact on the fetus. Usually, mothers are advised to take the lowest dose of paracetamol that works the fastest?
You can give me drugs, can you?
I'm sorry, ma'am. Since you said sometimes your heart is really bad, I would suggest you to see the doctor, and I will make an appointment with doctor if you want.
Yes, please, Miss Dewi.
Okay, I will make you an appointment with Dr. Ayu on March 15th, 2022 at 10 a.m. Could you be there, Miss Tungga?
Absolutely. Thank you, Miss Dewi.
With my pleasure, ma'am. And this is your vitamin.
Thank you.
See you later and have a nice day, ma'am.
Okay, see you soon, Miss Dewi.